And I said, come over, come on over, you'll say.
Good morning, ladies and gentlemen, and welcome to the Town of Portland podcast. We are live here in the Town Tech Educational Podcast Studio, and this is going to be our episode number 51. And with us in the studio is our first Selectman, Mr. Ryan Curley, and for the first time in about 2 years, our Chatham Health Director is actually here in person, Mr. Russ Melmed. Hi, Russ.
Hey, Dave. How you doing?
I'm doing. Hey, Ryan. How you doing?
I'm doing well, Dave. How about yourself?
Hey, you know, it's Friday Eve, as we say, to go from there. So great. It's a gorgeous day outside. We got a little bit of rain this morning, which was good, which was muchly needed as far as that goes. So, Ryan, let's start off with you. What's the state of the state here?
Sure. Yeah, we're doing well in the town of Portland. We've been very busy. There's a lot of activities that have been going on, and a lot more coming up. Mm-hmm. June is a busy month, I think, for across the state. But particularly here in Portland, we're very busy.
Yep.
We're at the Portland High School, and we have our high school graduation coming up
next Monday.
On Monday.
Yep.
So congratulations to all the graduating seniors. I'm sure we'll both be there, right, Dave?
I will be there. I will be. I'm doing sound, so.
All right, and we certainly wish them all the best in college or whatever their future plans are.
Yes.
And so I just want to highlight some events that we have going on here in Portland in the month of June. So like I said, it is a busy month. This coming Saturday, June 11th, is the Portland Library's 125th anniversary plus 2.
Wow.
Because they got a little delayed. There was something was going on a couple of years ago. I can't really remember. Maybe Russ might know, but
I can't think of anything.
So the celebration had been postponed, and it will be held this Saturday, June 11th, from 11 a.m. Until 2 p.m., and that's going to be on the town green, which is next to the library and behind the police station and the senior center.
Yep.
And our Parks and Rec department, our Youth Services department, and our senior center, they're all participating, as well as the library. And they've got a lot of live music, craft games, and food and fun for the whole family. So I encourage everyone that can make it to attend this Saturday. And the following week, we have our Juneteenth celebration here in the town of Portland. This is our 4th annual celebration, and that will be held at Portland's Riverfront Park on Saturday, June 18th, from 11 a.m. until 2 p.m. And there's going to be some food, a DJ, a bounce house, and it'll be a good time. So, again, another great event that we have going on. And then on Saturday, June 25th, Portland has a Pride Rally, and that's going to be from 12 p.m. until 2 p.m., and that's in front of the BIZ, the Brownstone Intermediate School. So certainly looking forward to that as well. So that are some of the events that we have here in June.
Sure.
So it's a busy month, and we're looking forward to all those great events. So getting back to the town side, some of the things that we've been up to. I know a lot of people are waiting to hear news on how we're doing with the track replacement. So
Yep.
I wanted to touch base on that. We have the RFQs, the request for qualification, have been issued. They've all come back. The deadline was a week or two ago. And the review panel is scheduled to look through them tomorrow. And then we'll be going through the RFP process on that as well, the request for proposal. So we're moving along, but it's good timing because we can't do anything until we hear back from the state. We're waiting to hear back from OPM. As you know, the town of Portland received a bond from the state of Connecticut in order to replace some of the track, of $500,000. $736 bond. And so I need to sign as first selectman the contract with the state, and I'm waiting to do that. I've been emailing the state saying, let me get that contract because we want to get going with this track. So
Yep.
As soon as I can get that, we'll get that signed, and then we'll get going with that. But
Sure.
Certainly we're probably looking at replacement of that track. That would be in about a year. I don't know if we'll be able to get through the RFP process and get a engineer and on board within the time frame of this summer. A lot of places are already filled up and booked for
Yes.
this year. So, and you have to do the paving when it's hot out because they actually pave they're going to grind up underneath the rubberized coating. There is asphalt.
Yeah.
They're going to need to mill that, grind it all up, and then they're going to have to repave that.
Yes.
And you can only do that when it's hot out in the summer months, really.
And there are only a couple firms that do that type of work.
Yeah,
as far
I
as that
think
goes.
we received three proposals in the RFQ from companies that responded. So that's encouraging. So
Yes.
certainly one of those three hopefully will get us a new track.
Mm-hmm.
So we're waiting on the state for that. I want to touch base. As you know, we have that $250,000 grant from the DPH, Department of Public Health, for finding our own water source here in town.
Mm-hmm.
The firm has been selected, and again, I had to send a packet to the state, to DPH, and they're reviewing that packet, and they just need to give us the green light, the go ahead that we're ready to move forward. Again, waiting on the state for that green light, and then as soon as we get that, we can
moving ahead.
we're going to move ahead really quickly once we get that. So I want to touch on the Riverfront Access Committee. As you know, we had an easement agreement with Tilcon, who is a very generous company to the town of Portland, that granted us an easement to access town of Portland owned property that's along the riverfront. And we're trying to get a road or a pathway so we can go from the Tilcon property, which is where the Tommaso baseball field was, and we're going to get to that riverfront. And I know Rick Shar and Lou Pear and their new committee, which has been formed, are actively looking at ways of funding and how to get the ball moving quickly on that. And I believe their first meeting is June 29th, I believe. So stay tuned. That's moving ahead, and we're very excited about that as well. On the economic development front, our Economic Development Commission has been very busy. We've been looking at ways to increase the walkability and the attractiveness of our downtown particularly. We're trying to get more foot traffic into our Portland restaurants, into our Portland stores, and they've been coming up with some really creative ideas on how to do that. They did a tour recently, and they talked with business owners, and they, just asked ways that we can, the town, by we, can be more business friendly and look for ways to improve. And one of the things that came out of looking at this was Chris Cody and Chris Cody's Golf Shop actually offered to sponsor and to adopt the median when that borders Route 66 and Main Street,
right?
Because it wasn't looking very great up until recently, and Chris messaged me and he said that Chris Cody's Golf Shop would be happy to supply the flowers and the mulch needed to fix that up. And along with them and our Portland Garden Club, they took that over, and it looks so much nicer there.
Yes.
It really looks beautiful. And so I'm personally hoping that kind of public-private partnership can kind of continue, and we can kind of make that go further down on Main Street and really try to beautify, make things more attractive, because we really want to encourage our Portland residents to shop local, and so that's so important. And we're waiting on that. And also we have Brainerd Place. That's obviously it's one of the big issues that everybody wants to know about. Things are moving on very well. I just talked with the site manager over there this morning, and I think that one house on Perry Avenue, that last remaining house, is scheduled to come down tomorrow or Monday, I guess it would be. But they were held back a little bit, something to do with the power company, something to do with Eversource, and it held them back a few days, but they're ready to get going with that. And there was a lot of I think
environmental cleanup that they had to do in there. Yes.
Yep. So that's been mostly completed, and they're just going to be ready to take that down. And also the Economic Development Commission and the Board of Selectmen, I think before or after our last podcast, toured the Brainerd Place project, and you were there, Dave.
Yeah,
and
we got pictures up on our website.
Yeah, and it was really great to see the inside of the Brainerd House as well as the Sage House, and tour the property to see how it's moving along. And when you look at all the demolition work that's been accomplished so far, as well as the interior, I just want to say I was blown away by the interior of the Brainerd House.
The architecture was spectacular.
And it really is in much better shape than I would have thought it would be for being abandoned for so many years.
What was it used for before?
That initially, it was the Elmcrest Psychiatric Hospital. When Mrs. Wagner owned it, it was under Elmcrest, and then St. Francis bought it out and so forth. But initially, I think the Hart Jarvis House, which is the first one that goes in, that was owned by a gentleman from New York, Mr. Chapman, and then that was kind of his private summary.
So it was a residential property.
It was a residential
150
property.
years ago. or
Okay,
whatever.
and then Mrs. Wagner bought that house, and they combined it into the Elmcrest property. Then St. Francis owned it, and then it kind of went to its demise there.
And
Always great when you can repurpose old
Yes.
structures like that.
Exactly.
Well, the Historical Society was instrumental in moving ahead with the preservation of rather than just tear them down, because there's a lot of history there.
And it was interesting touring the Sage House, particularly because that was where I think they housed some of the patients in the
Yep.
hospital there, and that had more of a different feel. The Brainerd House, had the old architecture, and then you go to the Sage House, and it's they even had a padded room in there.
Oh, yeah.
And so that was interesting to see, and I'm sure that will be renovated,
Repurposed.
Yeah, repurposed. We're not going to keep.
You don't need to preserve that history necessarily.
No, I think we can move on from that, but certainly it's going very well. And on the Main Street side, I also want to thank the Portland Historical Society for refurbishing and redoing the Welcome to Portland sign. That when you come on over from Portland to past the Aragoni Bridge, there's the sign that has the events that are going on in town and all that. And so they did such a nice job. It's got our newly remodeled Portland seal on
Yes,
that.
that was done by Des Cleary, one of our town tech students that redid that.
Yeah, and he did a great job, and it looks great. So I just wanted to say thank you to the Portland Historical Society, and that's the kind of thing that we're really looking to do. I mean, they did such a great job on that. Chris Cody is doing such a great job on the median, and we really want to keep beautifying our downtown, and so we're encouraged by that. And so yeah, those are some of the projects. Anything I'm missing, Dave?
I think we got you pretty much touched on everything. Obviously, from the standpoint of things that are going on, obviously the new park is fully operational. The splash pad is up and running daily from 10 to 7 every day.
Yep.
We've got the restrooms are being maintained.
And the concession stand is open. I stopped a week or so ago, and I got my first hot dog, and I watched some of the ball games going on there. And it really is great to see all the parents. They bring their chairs, and it's so different. I hadn't been to a Little League game since for many years, and now the kids have walkout music. It's like a big party over there.
Sure.
So they've upgraded the technology from when I played ball. So it was cool to see. But also one last thing I want to touch on is our riverfront development as well. So we've been working with our company who's going to be doing all this remediation work. That's Enviro Consultants and Recyclers. Unfortunately, due to some delays with the state, we couldn't begin this spring, so we're going to be doing that work in September once the
Riverfront Park.
Exactly.
Closes.
Once our Brownstone Exploration Discovery Park, which is open now, so go to the park if you can too. That's always a good time. And once they finish with the end of the season, we'll get in there and we can do our remediation. So certainly excited to get that work going. And we also have an RFP out for a public-private partnership on that. And that RFP is out until September 13th. So if you know of any entrepreneurs that want to open a restaurant or something, this was the perfect location. It's right along the Connecticut River, and it's really going to be a gorgeous spot once we clean up this property.
Russ, I think that would be a good side hustle for you.
Restaurants. I think there's something in my contract that says the health director can't be involved in any establishments that I also regulate. But I'll look into that. Maybe I can adjust my contract. Ryan's on my board, so maybe Ryan.
Absolutely. We got some steam there.
Right.
There you go. So that's it for me, though. So
Yeah,
thanks,
no, that
Dave.
was great, Ryan. And also I just want to shout out to we had a great Memorial Day parade.
Oh, that's right.
And the Sarah Sterry and her whole parade committee did a great job. We had the Great Hill Mountain Band playing down on the reviewing stand, which went over very, very well. So it was a gorgeous day, and it was a nice parade. So
It was great. It was great to see so many people and out and about and some great weather. So thank you, Dave, and thank you to Sarah Sterry Rudder as well.
Absolutely. All right, Russ, you're out of the bullpen. Come on in here.
All right. So, we can touch on COVID briefly, which is right now, I'd say we're heading in the right direction.
Yes.
Hospitalizations have been coming down for 3 weeks in a row. Cases have been coming down for 3 weeks in a row. And I think we're headed for a pretty nice June, July, and August before we start looking at the fall and winter surge. Most recent news is another vaccine seems to be headed for approval. That's the one that's manufactured by Novavax. For people who may have been hesitant to take advantage of the mRNA vaccines because they thought the technology was too new, this Novavax vaccine, which has proved to be pretty effective, is a very traditional one. It uses a very standard method for manufacturing a protein that mimics the surface proteins on the virus itself. So this is very standard technology. It's been used for decades to make vaccines. So for anybody who was interested in being vaccinated but worried about the new vaccines, once this Novavax gets approved, my hope is that those individuals will come into the fold of getting vaccinated.
Sure.
Because in Portland, we've still got about 15% of the population hasn't initiated vaccination yet. So that's actually pretty good news. Around 85% of residents of
that's
Portland
very good.
have started, had at least initiated vaccination. That's very good. And keep in mind, we still don't have a vaccine for people under 5. That's also good news. On that front, it looks like the Pfizer vaccine is headed towards authorization for children as young as 6 months old. So
nice.
pretty soon we'll have a vaccine basically available for anybody who wants it.
Nice.
So that's good news. We're not seeing a whole lot of people get very, very sick with COVID-19. So, I'm in the studio today. I'm not wearing a mask. Now, of course, I had COVID-19 about a month and a half ago. So I'm really not worried about myself.
Right.
So even though rates are coming down, there's still plenty of COVID-19 out there. So we're still seeing it circulating for people who haven't had COVID-19 recently, and especially people who aren't vaccinated or who are otherwise high risk. We're still recommending, if you're in a crowded indoor setting,
Wear a mask.
wear a mask. Those are the kinds of places and people who should be wearing a mask. Otherwise, especially if you've had COVID recently and you've recovered, or you've had a booster recently, my feeling is you're pretty well protected.
Right.
If a mask is uncomfortable or you don't feel like wearing one, I'd say it's probably okay. But,
Sure.
There are some people we're still really recommending wearing a mask in indoor settings that are crowded.
Yeah, no. Yeah, I think I just got back from California, with our music trade convention out there, and which the show was significantly smaller, but I would say that there were probably 30% of the people that were wearing masks. And on the airplane, that was probably not quite 50-50, but pretty close.
A crowded indoor settings, a trade show, an airplane. Tomorrow I fly out to go on vacation, a vacation I've been trying to get on for 2.5 years. I'll be wearing a mask mostly because I don't want to take any chance that I'm going to get sick on vacation.
Sure, absolutely.
So walking through an airport, sitting on the airplane, my flight's about 2.5 hours. That's not a big ask. I'm comfortable wearing a mask for 2.5 hours, and I'll be wearing an N95 mask to protect myself.
Sure, absolutely.
And those masks are ubiquitous. You can get them anywhere. You can probably get them from the town, probably as a stockpile of masks
we do.
that we still have. So if anybody is out there who says, I'd love to get an N95, you can probably reach out to the town of Portland. I think maybe Bob Shea in Public Works, or
We have some in the first Selectman's office. We also have test kits still, I believe, as well. We have a limited supply, but we do have them, I think, in the clerk's office. So.
Yes.
So reach out to the town. That's the other thing. If you're feeling sick, why not test? They're easy to get. They're free. You can call Ryan and get a test. So
Right. Now, what's the residual effects for the long haulers? How has that been?
There's an increasing focus on long COVID.
Okay.
And long COVID can be anywhere from just a couple of weeks, lingering symptoms that many people I know who have had, to people having symptoms for many months that will come and go, fatigue, problems with shortness of breath, problems with memory loss, things like that are really scary with long COVID. You do see some of that. There's an increasing focus on the research around long COVID, who gets long COVID and who doesn't. So what are the risk factors? Initially, there was a thought that being vaccinated really protected you well from long COVID. In fact, that's proving not to be true at this point. So people who are vaccinated are well protected from getting very sick, but you may in fact still get some symptoms of long COVID after you recover from what might be otherwise a very mild illness. So it's not something I want to mess around with. So you should do everything you can to protect yourself from getting COVID-19 if you can, because long COVID, there's still a lot to learn about it.
Right. Like anything else, it's the research is evolving, and
it's still a new disease. I mean, I feel like we've been living with COVID-19 for 2.5 years now, so everybody feels kind of comfortable, if you will, with COVID-19, but it is still a very, very new disease. I mean, think about how little we knew about HIV 2.5 years into HIV, right? That's where we are with COVID-19. Now, the fact is, 200 million Americans have had COVID-19 or more, so it's going to end up being the most heavily studied infectious disease ever. That's what I think. But still, only 2.5 years in, there's a lot we don't know about COVID-19 that we still have yet to learn.
Now, our infection rate in the district, is that down below 10% now? Or?
The percent positivity is just looked at statewide. We are under 10%.
Okay.
So, and you can look at that and look at historically what that tends to mean. Usually that means there's still a fair amount of COVID-19 out there. We've been typically in the summer months as low as 1% or less. So we've still got a ways to go to get to where we have been in the summer, the best summer months.
Right.
But that's been coming down steadily for the last few weeks. So I expect that to keep coming down. And so that'll be a good indicator. Looking at infections, it's not the greatest measure of what's going on at this point. People are getting tested at home. That's not reported. So when you look at case numbers, right? In the last 2 weeks in Chatham Health District, we had around 350 cases reported. That's only those official reports.
Right.
There's probably 3 or 4 times that many cases of people just testing at home. That goes unreported. If you're looking at those case numbers, I'd say it's not the greatest indicator. Look at hospitalizations, and that's probably a better indicator of where we are. So we're sort of coming down. So I'm encouraged that in a couple of weeks, we should all feel very comfortable wherever we go.
Well, I think most of the healthcare facilities and hospitals have relaxed their COVID precautions, so to speak.
I think visitation is now being relaxed, so you can visit people in long-term care facilities for a long time. If you had somebody, a loved one, who was in a nursing home, you couldn't go see them.
I know.
Period. Full stop. It didn't matter who you were. Didn't matter if they were on their dying breath. You couldn't go see them, which was really heartbreaking.
Through the window.
Right, through the window. We're not there at this point. There's still some healthcare facilities that still require you to wear a mask when you walk into them, but for the most part, you can visit loved ones, and those things are relaxed. And we have plenty of capacity in our healthcare system right now. So when you look at hospitalizations during the peak Omicron wave, they peaked at around 2,000 statewide. We were near capacity in most of our hospitals, in the emergency room, in the ICU. We're down to somewhere in the area of 200 hospitalized cases of COVID-19 right now.
Okay.
So hospitals have capacity, so we're doing well on that front.
Well, that's good. So anything new as far as
other health department stuff? We're working right now. We got a 3-year, nearly $500,000 grant from the Food and Drug Administration to basically transform our food inspection regime. So we're working towards transparency. In the next 6 months, we're going to be bringing on board a digital inspection platform that's going to allow not only our inspectors to use tablets to do their inspections instead of paper, but it's going to allow the residents to look up the most recent inspection for their favorite restaurants, if they will. So we're really this is going to work towards transparency, efficiency. So that's good. We also hired a new part-time food service inspector. Her name is Dia. So anybody who's out there who sees somebody wearing a Chatham Health District shirt doing inspections, we've now got 7 people who are doing food service inspections for us.
Okay.
So that's quite a lot. We're also very busy. I mean, in town of Portland, the business has picked up quite a bit. People are taking out a lot of applications to put in pools and to do renovations to their homes. So like Ryan said, the town is busy, the health department is busy, but we're really excited about this grant, which again is going to make us more efficient and increase transparency and let people look things up a little bit easier. People will also be able to submit applications online, pay with their credit card. So right now we're still old school. Everything is paper. check, or cash.
Yeah.
So we're really excited to be able to make things a little bit easier for our customers.
Sure.
Because we're very busy. Anything that can make it easier for our customers and
Absolutely.
can make us more efficient is good.
That's a win-win.
And when you can do it with a grant,
That's even better.
even better, right? So
Free is good.
Free is good, right? So we're really excited, at Chatham Health District about everything that's going on. Really excited. We opened up a new pizza place in Portland down by the marina. People seem really excited. I think what's it called?
Is that a food truck?
It is. It's not really mobile. It seems to be stationed right there all the time.
Yes.
Yeah, I think it's a trailer that they could haul to different places. I don't
Okay.
think it's really on a truck.
Okay, yes.
But people are really excited about that.
Yes,
They're
yes.
really excited. It's getting rave reviews for their pizzas. So
That's a good thing.
I think that opened up in the last month. So
Yes.
things are moving in Portland. It's really exciting. The most recent census data, I think, indicates that Portland grew. So, a lot of towns, a lot of rural and suburban towns in Connecticut are shrinking
Sure.
in terms of the population. Cities tend to be growing. Connecticut in general is losing population, but Portland grew.
Yes.
So you're doing something right, Ryan. If
Yes.
people are moving to Portland, I think that's a really good sign.
Yeah, because I think our grand list grew, Ryan, right?
Our grand list grew over 11%. Yep.
Wow.
So that's a good thing.
That is a good thing.
Yeah. It just makes the pie a little bit bigger. So whatever.
That's
Yeah.
right.
Go from there.
So on a public health front, I think it's going to be a good summer with COVID-19. I'm excited.
Yeah. Well, I think now, as far as in relation to, I think our graduation is going to be next week. I'm doing, I think, 4 other graduations next week. So, again, from the standpoint of people, the schools are relaxing. I think here at the high school, masks are, kind of optional as far as that goes, and which is good. It leaves everybody that, make their own decisions and work
Yep.
it out from there.
If anybody's worried about COVID-19, wear a mask, wear a high quality mask.
Yeah.
We did just have proms. We did see outbreaks associated with proms.
Yep.
For example, in Colchester, after the senior prom, 1 out of every 3 people who attended tested positive in the next 6 days.
Oh, okay.
So there was a pretty sizable outbreak after prom. We've seen that statewide at different proms. So big mass gathering events where a lot of people get together, what you should expect is there will be somebody you will come into contact with who is infected with COVID-19 and capable of spreading it.
Yep.
So that should be your assumption in those kinds of situations right now. So wear a mask if you can, keep your distance. If you're really, really high risk, get a booster if you're eligible. And if you're really, really concerned, you can stay away from those big mass gatherings. But
Sure.
at this point, it's about individual choices and your comfort level with the risk involved.
Absolutely. Great, Russ. As far as the restaurants in the district, I think you've been kind of keeping those busy, doing all your food inspections and all of that.
Yeah, we're really, we take food safety seriously.
Yeah.
So, we are required to go out and inspect restaurants on a pretty regular schedule, depending on what they're making. So the restaurants that do things like heating and cooling a lot, those get inspected much more frequently than places that are just selling, prepackaged foods and things like that. So we definitely go out there. One of our main inspectors is Zach Jessic. So he's one of our newer inspectors. He is amazing. He focuses heavily on education.
Yeah.
For those restaurants, if they're doing something wrong, if they're not washing their hands, you're going to get debited for it. Okay.
Yeah,
so,
yeah.
so you might fail the inspection, but he's really education forward, education leaning.
Oh, that's good.
As opposed to being punitive. So, we try to get our restaurants going in the right direction if they're not doing so hot. And our process is you get inspected. If you fail, you get re-inspected in 2 weeks.
That's it.
If you fail that one, we bring you in for a hearing. So we say, okay, let's have a conversation about getting you on the right track. Let's develop a corrective action plan, things like that. But we're out inspecting restaurants and temporary events. So Ryan just mentioned a bunch of temporary events coming up. Food trucks, food vendors come in, they take a permit out with the health department. At some point in the next month or two, it's likely that food trucks that are licensed in other parts of the state are not going to have to take out permits here.
You got that how's it called?
Reciprocity.
Reciprocity. There you
That's
go.
right.
Think of the word.
So the Chatham Health District Board of Directors authorized me
honor
to execute an MOU, which will honor licenses for food trucks. These aren't the types of places where they would set up a tent and a table and a grill and start flipping burgers. Those are still going to have to take out permits. These are proper food trucks that have all the stuff they need.
Yeah.
A restaurant on wheels, basically. If they're licensed somewhere else, they're going to be able to come in and just tell us, hey, we're going to be at Riverfront Park for this event.
And that's going to make it easier on you guys too, as well.
It'll make it easier on us. We can still inspect them. So if they haven't been inspected recently, we can inspect them. But I think it's going to be, it's going to balance the public health interests with the
Right.
business interests, I think, very well.
Sure. Well, that's good. Awesome. Well, thank you, Russ. I appreciate it, and it's great to see you in the studio.
Yeah,
My
it's good to be
gosh.
back in person. It's nice.
When you called in, I says, "Oh, Russ, I'm outside door number 5." And so forth. So anyway, anything else, Ryan? While we got all right.
I don't have anything else. I just thank you for having us, Dave.
Oh,
and,
no worries. Well, again, this is episode number 51. It's amazing that we've been doing this, almost a full year. In fact, it's actually, I think, been longer than a year because we've been kind of going every other week or
It's been probably
once a
2
month.
years, but episode 53 is 1 year's worth. So that's a lot.
Exactly. So anyway, all right, ladies and gentlemen, we are live right here in the Town Tech Educational Podcast Studio, and this is episode number 51, of the Town of Portland podcast, and with our first selectman, Mr. Ryan Curley, and our Chatham Health Director, Mr. Russ Melmed. So until next time, be safe, wear your mask, and go outside and get some fresh air and enjoy yourself and have a great, we're going to have 4th of July coming up pretty quick. So that's a good thing. So again, until next time, thanks so much, and we'll see you next time. Thank you for joining us today. I'm your host, Dave Kuzminski. Please tune in every week for new and relevant conversations about the town of Portland. You can find us at portlandct.org or at YouTube/Town of Portland, and now wherever you listen to your podcasts. If you've enjoyed our podcast, please consider subscribing and sharing with friends. This podcast was produced by the Town Tech Educational Partnership Program, which is a partnership between Portland High School and the Portland Town Hall. If you're looking to start a podcast for your business or organization, check out towntech.org/podcast to learn more.